Welcome back to Ladies of Another View on Beck. We've been talking quite a bit about the World Health Organization, what's been going on over there, what happened in Geneva a couple weeks ago. And it's just been scary because we've been talking about this one world order now for how many years? You know, first it was Agenda 20 or 2020, and now it's 2025, now it's Agenda 2030. And it's like but each year it seems to be getting closer and closer to a one world government. And so we found this gentleman online. I was really intrigued by some of the information that he was sharing. I want to welcome James Roguski to the program.
Thank you so much for having me. There is so much to talk about. Where would you like to start?
Well, why don't you first give us a little bit about your background? What exactly does James do out in California?
Well, you know, I've done many things in my life. I'm 62 years old, and it essentially has boiled down to whenever I see something that is just absolutely ridiculous, I have to speak up. I have to say something. But I was raised, I grew up in Ohio, and it's not just about complaining. It's about saying, look, you know, here's the problem, and you know, this is maybe a solution to it, or this is something that should be done. And most recently, on March 28th, I discovered a document online, you know, just a boring government document. You had a story earlier in the show about Nancy Pelosi going to Taiwan. Whenever there's something seemingly bizarre and strange and weird in the news, I always don't watch the news, and I go, what is it that they don't want me to be looking at? I need to go digging elsewhere, because all of the distractions are designed to get your attention away, you know, from the really boring stuff that they're doing. And what I found was that the Biden administration had published proposed amendments to international health regulations. He proposed that back in January. I didn't discover it until the end of March, spent April and May spreading the word about it. And myself and quite a number of other people, we managed to actually defeat the attempt to not sell part of the United States, but give away sovereignty, which in effect could have, would have set up Tedros Ghebreyesus not as a director general of the World Health Organization, but as a dictator general of what I call the World Hypnosis Organization. We averted that change to international health regulations. That pathway is continuing to, you know, be something that we all need to pay attention to. They'll be meeting again in November. They've directed nations around the world to submit, you know, potential amendments by September 15th. But there's a whole nother parallel path, which got started back in November of 2020. And they have many, many names for it, but the vast majority of the population, if they've heard about it at all, realize that the WHO is trying to get 194 member nations to give up even more sovereignty, more authority to the WHO, and it's referred to as they're negotiating a pandemic treaty. And so I think that's what you were referring to. There were events that happened from the 18th. So it was supposed to be from the 18th to the 22nd of July. And if that's what you wanted to discuss, I'm certainly happy to get into the details on that.
So, James, you know, we know that the Director General of the WHO, he was pretty much instilled into the WHO's position by the CCP. We know he's a Marxist activist. But I guess for our people at home that really want to understand what is the potential there, if they were to vote it in and if we were to give over our sovereignty, how would that affect countries and people on a daily basis? Worst case scenario.
Depending upon which of those paths that we're discussing, okay, what we averted would have given the WHO many, many, many powers that we don't need to go into the details of that because they lost. It didn't happen. Okay. And so that was an attempt really by the Biden administration to give away sovereign control as to whether or not we have control of what is going on in the United States in regards to emergencies and pandemics and things like that. part of the evidence that was brought to bear in that scenario were changes to law and definition of terms by the CDC. And tell me if this sets off any alarm bells in your head. The Obama administration published an 84-page document in the Federal Register on January 19th, 2017. Okay, the last day in office, last full day in office, they changed definitions, they changed the rules of the road. And, for the most part, until I started making us think about it in April and May, nobody had any idea. And so what it really did that was very, very important was it made it acceptable under CDC regulations to stick something up people's nose as a test, whereas international regulations, you have to have the person's permission to do that kind of testing. It was actually the Obama administration that wrote the regulations the day before Trump got into office that said, no, if we want to stick something up your nose, we're going to do it whether you object or not. What's going on now and what happened from the 18th to the 21st in Geneva was the Intergovernmental Negotiating Body, which is a group of people that were put together by the WHO to negotiate a pandemic treaty. They were supposed to meet for 5 days. It was supposed to be live streamed. It was supposed to be recorded. They met for day one. They met for day two. And despite what they said about live streaming it all of a sudden on Wednesday and Thursday of that week, it went completely silent. They did not live stream it. They haven't spoken of it. They didn't publish any documents yet. I look every day. I look just before we got online. And on Thursday afternoon, they came back and they redefined the word transparency, as far as I am concerned. They had just come out of 2 meetings and they came back to tell the world that we're being very, very transparent and we're going to let you know what we decided in secret about the future of health on the planet. And they decided that they are working towards a pandemic treaty that will be legally binding on all of the member nations, 194 member nations of the World Health Organization. That wasn't an enormous surprise because they don't talk really about anything to do with what the average person would think is health related. There's no discussion about whether or not the injections are truly safe or effective. There's no discussion about early treatment with essential medicines. None of the discussion about whether or not the countermeasures that have been taken, the masks and the social distancing and the lockdowns and the curfews. I still have never been able to figure out how a curfew, don't go out at night because the boogeyman might get you. I still have no idea how that is anything other than a control mechanism. Time of day really doesn't seem to matter whether or not somebody could transmit a communicable disease. But what they did was essentially say, on July 13th, they published the very first working draft of what they're working on, which is a, hopefully for them, legally binding pandemic treaty, where they want all of the nations to just sign on the dotted line and say, yeah, we want to give our control over to the WHO. It's in writing. It's not a conspiracy theory. It's a conspiracy document. If you want to have a good sedative for 2.5 weeks, you can take each of the 19 pages and read 1 page before you go to bed. It's as boring could be.
Welcome back to Ladies of Another View on Beck. We've been visiting with James Roguski, and he's been talking about the WHO, the World Health Organization. Let's bring James back to the show. Hey, James. So right before the break, we were talking a little bit about the treaty agenda. Why don't you dive a little deeper into that?
Well, it's very, very high level in terms of very specific. They refer to it as a framework, okay? And the difficult part for people to wrap their heads around, I hope I can explain it, is that, yes, we have to be concerned with what they're doing, but what they're really doing is they're setting up a framework so that people who are in local administrations, whether it's city, county, state, province, national government, whatever, they're getting not exactly marching orders, but they're getting a framework guideline where the WHO is saying, look, all of you, young leaders around the world, this is where we are headed. These are the fundamental things that we're going to do with this treaty. Meet us there when we hope to pass this in 2024. Now, the last one on the list is probably the most important. I see that you have that up on the screen right now. It would be expected that the governance mechanism would be based in the WHO. There, simple words, but when you actually get into the nuts and bolts of it, they're essentially saying, let the WHO have the authority and the sovereignty to be in control of everything. The seventh one that they have in their list, and it's a little bit different on the top 10 there, but they talk about something called One Health. Sounds pretty good. It doesn't mean that they're concerned about the health of the one individual, who's visiting their doctor because they have a problem. Their redefinition of One Health is that they want to have one organizational body, clearly the WHO, being in charge of every single aspect of health on the planet, not just human health, not just domestic animal health, chickens and cows and pigs and so forth, but also wild animal health and even agricultural and plant health. It devolves all the way down into climate change and all of that. If you think about what's going on in the Netherlands, you can see and for that matter, Sri Lanka, when the government bureaucrats try to tell farmers how to farm, all right, they mess it up horribly. But yet, that's what this pandemic treaty would put the control of every aspect of society under the control of the bureaucrats at the World Health Organization. Now, they put it in language that's all confusing and it sounds really nice. They're setting it up in a framework. The danger is that your local authorities, who may or may not be detail-oriented and may or may not be able to read between the lines and see that the language doesn't mean what they think it means because they have their own way of using the English language to confuse people. We all have to be vigilant everywhere, wherever it is we live, every state in the United States, every province in Canada, every nation around the world. And that's what I've been working to try to raise awareness of with everybody everywhere.
Oh, that's great.
So James, when did we actually start to give away sovereignty to these organizations? I mean, is it just by our membership in these organizations? I mean, the WHO, the WEF, United Nations, they're kind of all under one umbrella, are they not?
Well, that's actually a spectacular question. In what I was doing back in April and May, I had found many documents. I try to do everything that I touch is based on just shedding light on their own documents, okay? And so Harry Truman signed on June 14th, 1948, a joint resolution that was approved by both houses of Congress. I think everybody's familiar with that sort of process. Section 5 of that agreement, it was only 3 pages long, pretty much in English said, yes, we're joining the WHO. We want to try to help the world, be more healthy after World War II. But it doesn't matter what the WHO says. We in the United States are not obligated to change any of our laws, period. Okay. Now, that's what they said in 1948. That's the ruling legal document that got us in. Trump started a process to get us out. He should have started it earlier if he really wanted us to get out. Biden stopped it, put us right back in. There's a House bill that we're spreading the word about, 419, that has, I think, about, at the moment, 50 co-sponsors to get us, actually to defund the WHO because we give them money. And there's another piece of legislation, 7806, to get us out of the UN and get us out of the WHO. I referred to the WHO as the World Hypnosis Organization because for the most part, there's a couple of little things with reporting and sharing of data and things like that. But for the most part, they're spectacular hypnotists. My girlfriend and I literally this morning went to pick up a package that was being delivered to a package pickup location. And when we got the tracking email information to see that it was ready, it quoted the WHO's advice about wearing masks. And so
Oh my goodness.
it's down to that granular level. And all I'm here to say to people is that's their advice. It's not their dictate. They are not the boss of you. But when people hear on television, they hear officials, they see the WHO, the WHO, the WHO, it's like a hypnotic suggestion, like all of the pharmaceutical advertisements that say, ask your doctor if such and such is good for you, right?
Exactly.
Well, they don't tell you what it's for, okay? It's all subliminal advertising and promotion and hypnosis, so that at some point people go, oh, the Secretary General of the World Health Organization has spoken, thus it must be. And if you're willing to allow yourself to be hypnotized and give over your sovereignty freely, no one can stop you other than people like myself saying, hey, don't do that. We need to realize that we are still sovereign. They are trying all of the time on two paths, adjusting international health regulations, which is one path, and trying to get everyone in the world to agree to a pandemic treaty. And I'm very active. You asked me earlier, I'd like to do this, and some people think I'm crazy. It's, television and all that. My phone number is 310-619-3055. If there's anyone in the viewing audience who would like to discuss this and work towards, making sure it stops, 310-619-3055. It's complicated. I welcome the opportunity to have an in-depth conversation. I've met the most wonderful people, because the people who call me are like, we have to stop this. They care. They're concerned about what certain forces in our own government are trying to give it all away. And I'm just basically saying, no, that's not going to happen. We stopped them in May. We'll continue to be vigilant and pay attention to what they're doing. All of this is written up on my blog, which is jamesroguski.substack.com. And it's happening in Ecuador, it's happening in South Africa, it's happening in Malaysia, and it's happening in every state of the union. And so vigilance is important. I try to summarize all this complicated legalese, gobbledygook, and turn it into English so people can fight back.
Perfect. Well, thanks for joining us today, James. We really appreciate it. And it was kind of something, we had some more questions, but we've simply run out of time. So I know we're going to need to get you back on. If you had 30 seconds to tell our viewers what to do, what would it be? Just stay vigilant, just be aware?
I'm actually about to publish something called the Declaration of Demands. It's a takeoff on the Declaration of Independence.
Okay.
Let's decide what it is you want and demand that your government do it for you.